Castrating Horses. The U.S. Department of Agriculture's book, Disease of the Horse, published in 1907, described the event. The animal having been thrown on his left side, and the right hind foot drawn up on the shoulder, the exposed scrotum, penis, and sheath are washed with soap and water. Notice they said thrown. Basically, ropes and people were used to lay the horse down, and a blanket or jacket covered the horse's head to calm it, and the surgery commenced. I would imagine the surgeon worked very quickly. Thankfully, with modern medicine, we don't have to do that anymore. Castration of horses is removing its testicles. This prevents it from reproducing as well as decreases testosterone levels, which greatly affects behavior. We do this for a variety of reasons: to prevent it from breeding, for behavior and safety for people and other horses, and allowing it to be with other animals, and also preventing unwanted horses. If you are asking if you should castrate your horse, that probably means you should castrate your horse. The only people that need non-castrated horses are the ones who are breeding. Otherwise, it's just not worth having a stallion around. I tend to castrate horses between 1 to 2 years of age, but have no problem doing it younger, having done it at 6 months if necessary. Older horses that have ended their breeding career can be castrated as well, but the surgery tends to take a little longer because I have to work on preventing hemorrhage with the more developed blood vessels of an older horse. One of the questions people often call and ask my clinic is when or what time of year they should castrate their horses. This is mostly dependent on weather. I like temperatures to be consistently above 50 degrees. If the weather is not above 50 degrees, I tend to see an increased probability of swelling at the surgery site, which sometimes requires extra work and vet visits to make sure that that does not become a problem. With Kentucky weather, I tend to stop castrating in November and not start again until March. Granted, with weather patterns, I feel like this time period could be shifting. In March, scheduling can be problematic because it is often raining. While a light rain won't slow me down, I don't want to do the surgery in the pouring rain, and really slippery conditions on the ground can make for a rough recovery for the animal. In reality, it's usually April through September/October that I perform most of my castrations. A lot of people are concerned about the flies and controlling flies around the surgical wound, especially in the heat of the summer. But I don't believe this is much of a problem, especially if you use fly spray on your horse, though not on the wound, just by spraying it on the rest of the horse. Also, I do not castrate by moon signs. I've had that question so often, and many people believe in castrating by the moon so much that they won't schedule with me on days I am available if the moon tells them not to. And look, I haven't seen any studies proving or disproving the effects of the moon on castration surgeries. If someone presents one, I would be happy to look it over. But this is how I explain it to most people. I'm the son of a merchant marine. I understand the moon affects tides, or water. And I won't say the moon doesn't affect the water in people's bodies. I certainly feel like the moon affects people when it's full, because I do feel like I see more crazy clients around the full moon. However, I would also like to say my skills as a surgeon and the drugs I have available to me make me completely confident that I can castrate a horse not based on the moon signs, and still have a successful surgery. Having castrated horses against the moon signs with no ill effects supports my theory. Once we have determined a date at the proper time of year, there are other things I need to complete a castration. Preferably a horse that is handleable. I have to give the horse injections to complete the surgery. If to catch your horse, you have to place feed beneath a tree, hide in the tree, and jump out of the tree with a lasso to catch the horse, that is not a prime candidate for me to do surgery on that horse. More practically, if you have a trained horse, I need a flat, grassy spot to do the surgery in. I'm not going to castrate a horse in a barn stall. Clients often ask this, and this is incredibly dangerous. When the horse is recovering, it sometimes staggers around. This makes a very unpredictable environment. I unfortunately have had conversations with clients and vets who have castrated horses in stalls. The horse in question recovered poorly and kicked its leg through a wall, and on attempting to stand, broke its leg, which required a euthanasia. Don't castrate horses in barn stalls. Now, to every rule there is an exception. I have castrated miniature horses and donkeys in stalls and in a barn just because of their small size. They are more controllable. I will castrate in arenas, but I still prefer a nice, flat, grassy area. Often arenas are muddy or dusty, and while that's not the end of the world, I don't need extra dust getting in my surgery site. So what is the ideal site? A nice, big, flat, grassy area. When a horse recovers, it may stagger and trip and fall, and soft grass is better than a rock or concrete or hills where a horse could roll down. Now that we have determined when and where and which animals to castrate, let's walk through a castration. First, your horse needs to be halter broken. I have darted wild horses, and while it can be done, is not easy. I have to give injections in the vein, and I cannot do this from a distance. While I can give in the muscle injections from a slightly more distance or with a dart to make a horse groggy, this takes extra time and doesn't always work well if the horse is excitable. If you don't discuss special handling needs with your animal before a scheduled castration, your vet very well may not perform the castration. Once I had a client show up with a mule in his trailer. He wanted that mule castrated. I was concerned because the client had a self-bandaged arm. The client appeared to have a broken arm from that mule. One look and a few swipes from the mule later, and I refused to even attempt that surgery. Your animal needs to be trained. As vets, we are not going to risk our lives for an untrained or dangerous animal. Vets understand young animals may be a little needle shy and can work with that, but animals that are dangerous must be trained or special things worked out to handle them. Generally, once we have all this worked out, we lead the horse to a flat, grassy area in which we're going to castrate in. I will give an injection in the vein to make the horse groggy. Either the owner or my assistant will hold the horse's head for this. While the horse is getting groggy, I will then give it any vaccinations it needs. At the minimum, I want to make sure the horse is up to date on its tetanus. If the horse received a tetanus in the last 6 months, I would not need to vaccinate. But generally, I am at least going to give a tetanus toxoid, which will protect the horse from tetanus in 2 weeks, and then I will give a horse a tetanus antitoxin, which starts working immediately and will generally last long enough for the toxoid to have its effect. Now, some people worry about Tyler's disease, a rare disease that can occur when administering vaccines. Thankfully, I have never seen this happen and would recommend risking that because I have seen tetanus, and that is not pretty and is worth preventing. At this time, I would also administer other vaccinations that the owner wanted. I've had conversations with owners that don't like using vaccinations, and while I may personally disagree with that sentiment, this is their horse, and I respect their right not to vaccinate their horse, except for tetanus. If I'm doing surgery on this horse, I will vaccinate the horse with tetanus if there is no record of current vaccination. If not, I just won't do the surgery. I will sometimes vaccinate without the tetanus antitoxin administration, but that's just because that product tends to go on back order a lot and I can't give something I just don't have. After I get the vaccines in, I also tend to draw blood for Coggins if that is needed. Coggins is a test for equine infectious anemia that is required for horses to travel. Then I will tie a long, soft rope around the horse's neck. Generally, the horse is pretty groggy now. If I haven't already, I will make sure I see 2 testicles. This is a good time because often the horse is sedated, and if I need to feel up there, there's less chance that he's going to kick at me. If there are not 2 testicles, then I will typically allow the horse to wake up and refer to a referral institution for cryptorchid surgery. Cryptorchid surgeries are not something that I want to do in the field if I can prevent it. Now we see the horse's nose is at its knees, so it's time to give a second shot, typically a drug called ketamine. Nose to the knees, ketamine, please. I give that second shot in the blood. This is a medication that will lay the horse down. After I have given the drugs, I will generally take over from my assistant or the owner and let the horse lean his forehead against my chest. I may use the halter for a little stabilization, but notice how I hold the lead rope and my rope bunched up so there's no chance if I lose control of the horse that the rope could get tangled around me and pull me around. Many people want to fight the horse here and push him down. There's really not a reason to do this. The horse weighs more than you and it's just not worth fighting. The drugs will win. I lean against the horse's head, and that keeps him steady, and as he gets weaker, I apply a little pressure, pushing him backwards. Hopefully he sits down, and then I can gently guide his head down so he lays down. It's more graceful sometimes than others. After that, I have someone grab a front leg while I grab the back leg, and we roll the horse on his back. Some people prefer to complete this surgery on the horse's side. That's completely fine. If you do on the horse's side, you tie a leg forward and lean over the horse's back or rump to complete the castration. I've done this a few times, but much prefer my method. When the horse is on his back, my assistant or the owner can straddle the horse's neck and hold the front legs. This allows them to balance the horse and keep it stable on its back. This also allows me to see the entire horse. I can watch for signs that the horse is waking up too quickly. I can see if the horse is breathing, and I can see if the owner is fainting, and all of this is in my field of vision with the surgery site. If the handlers are squeamish for the next parts of the surgery, they can close their eyes or look away, but still keep the horse stable for me. Next, I put a towel over the horse's head and eyes. This, as previously stated, as they did back in 1907, calms the horse. But I'm not sure that would help without the anesthetics. But for what I'm doing, this actually helps the anesthetics. It blocks sunlight from the eyes, and that sunlight would stimulate the horse to go through their drugs faster. It also keeps grass or dirt from scratching the eyes during the procedure. I then take my long soft rope and loop its long end around the horse's leg twice. I will do this between the hoof and the fetlock versus on the leg. If this is a miniature horse, sometimes I can, instead of using my rope, just use the halter and lead rope for this protection. For larger horses, I then will either let a trusted assistant hold the rope, or I will tie the rope at the neck of the horse. What this does is if the horse wakes up, the rope will prevent him from kicking one leg. This allows the surgeon to duck and avoid the other leg, knowing there is a safe place to hide in. That's also why you tie the rope if you don't have a very trusted handler to hold the rope. So next, I have my gloves on, and then I flush the area with betadine and water. I then complete what I call a modified park technique in honor of the surgeon who really taught me to complete castrations. I will then cut the bottom 1/4 of the scrotum off. I will isolate the right testicle. Generally, there's one membrane I have to go through with the scalpel, and the rest I strip down with my fingers. I will manually break down the cremaster muscle, and then I apply my emasculator. Remember, surgeons, nut to nut. I like the kind of emasculators that both clamps and cuts. There are no sutures here, so I have to give it time to clamp off the vessels. I usually have a towel clamp in my bucket. Some horses have very small testicles, and I will use the towel clamp to clamp them so they don't get lost sliding back into the body. If this is a mule or a donkey, I will apply a circumferential or more likely a transfixation absorbable suture, typically one absorbable, as mules and donkeys tend to bleed more. So I want a little extra protection with that extra ligature. I don't do this with horses. I now start working on the left testicle and isolating it. Once I get that testicle, before I remove my clamp, I make sure it has been at least 90 seconds. The larger the vessels, the longer I will wait to release that clamp. The moment of truth. When I release that clamp, I watch for hemorrhage and hope and pray there is none as I watch the stump as it retracts into the body. I then repeat the procedure on the left. When I'm waiting to cut that left testicle, I then go back to the right and stretch the surgical site to allow for drainage and trim loose and hanging tissue, making sure not to hit any blood vessels. By the time I'm done, and maybe a joke or two later, it's time to cut the next testicle off and then trim and stretch the surgical site. Notice I'm cutting the testicle at this time as well. I want to make sure that we have the complete testicle and that we have the head, the body, and the tail of that testicle so that there's not a proud cut horse. I then pour some of my betadine water solution into the surgery site and let the horse lay down on its side, removing my rope. I make sure to place the bucket far away from the horse, which will soon wake up. I will also pull the down front leg forward so there is not undue pressure on nerves that could potentially cause the horse to get nerve damage. If the horse wakes up too quickly, I would sit on his neck to prevent him from raising and flopping around like a fish. And if I can't, and the horse has a bad recovery, the most I do is try to stabilize it with a lead rope. If there is a bad recovery, don't let the client or yourself get hurt. It's not worth anyone getting hurt. If you have a large, flat, grassy area, it should work itself out safely. Ideally, I watch for signs like the ears to twitch, maybe the tail moves a bit, the nostrils twitch a little bit. And when I see some of these signs, I will remove his eye cover. He hopefully will then sit up, and then another minute or two later, stand up. We get him back to the stall when he's ready, and then I tell the owners no food for the night, water is fine. For potential breeding accidents, he may have another shot where he could inseminate a horse for about 2 weeks. I mean, the book says a month, but I just think 2 weeks will get that last shot out there if he has it. And he needs water for the rest of the day, but no food. There may be some bleeding, but as long as you can count the drops of blood, it's not a problem. The next day he needs to move, whether it's a playmate chasing him or the owner making him lunge. Also the next day I start my anti-inflammatories. The anti-inflammatories and lunging keeps the swelling down. 2 weeks later he should be normal and good to go. If you are a vet student, I am working on getting some doses that I use on my Patreon page. I know many vets that give antibiotics after this surgery. I wouldn't do this unless there was a drastic contamination during the surgery. I leave this wound open to prevent having to use antibiotics, and typically I find systemic treatments of antibiotics are not needed during a routine surgery. I'd rather save the antibiotics for when I really need them. That's how I do a castration. Hopefully that can prepare you if you are going to come to my clinic for a castration, or if you're a vet student, hopefully that'll give you an idea of how to perform a castration. Or for any other horse owners out there, I hope you enjoy just seeing how we do this, and hopefully that can help inform you. I'm Dr. Nathan. Thanks for listening. I hope our discussions are valuable to you and aid in giving you perspective. If you want to contact us, please reach out to theveterinarianpodcast@gmail.com. Please subscribe to and like our YouTube channel and share with others. For more information, please join the Patreon at patreon.com/theveterinarypodcast. Membership is free, and you can decide what other information you may want to purchase to support our work. Thanks for listening, and I hope this perspective can help us improve the world.